Should you worry about a pedunculated polyp during polypectomy? Imagine finding out you have a polyp in your colon. It might sound alarming, but many polyps are common and can be removed safely. A pedunculated polyp is a type that has a stalk attaching it to the colon wall. During a polypectomy, doctors use special tools to remove these polyps, often with a wire loop called a snare. Because pedunculated polyps have a stalk, they are usually easier to remove than flat or sessile polyps. However, there are some important things to consider. The main concern with pedunculated polyps is bleeding. Since the stalk contains blood vessels, cutting through it can cause bleeding during or after the procedure. To prevent this, doctors often use electrocautery, which applies heat to seal blood vessels as they cut. If the polyp is large or has a thick stalk, the risk of bleeding can be higher. But overall, bleeding is usually manageable and rare. Another potential issue is perforation, which means a tear in the colon wall. This is less common but can happen if the polyp is large or if the procedure is complicated. Perforation may requiring additional treatment or surgery, but with experienced doctors, the risk remains very low. It is natural to worry about complications, but remember that polypectomy is a well-established, safe procedure. The goal is to remove polyps to prevent them from turning into colorectal cancer, which is a serious health concern. Removing polyps early can significantly reduce your risk of developing cancer later on. If you have a pedunculated polyp, your healthcare provider will carefully plan the removal to minimize risks. They might use special techniques to control bleeding or choose the best tools for your specific situation. After the procedure, follow-up appointments are important to check for any signs of complications. In summary, while there are some risks associated with removing pedunculated polyps, they are generally safe and effective when performed by experienced medical professionals. The benefits of removing potentially precancerous growths usually outweigh the small risks involved. If you have concerns or questions about your polyps or the procedure, talking openly with your healthcare provider is the best step. Remember, early detection and removal of polyps play a vital role in maintaining colon health and preventing colorectal cancer.